Hi, I'm Alan Kamrava. I'm a board-certified colon and rectal surgeon. I operate out in Beverly Hills in Los Angeles. I'm associate teaching faculty at Cedars-Sinai Medical Center. I wanted to go over some of the cases of patients I've treated with the laser for pilonidal cyst and to show a before and after, so for people to understand what that looks like. So one of the questions I get from patients a lot is, what does it look like with the laser treatment for pilonidal cyst? And so this first patient, you could see in a pre-treatment photo, run-of-the-mill average pilonidal cyst, not so inflamed, not so complicated, has what you could see is several small pits down the middle of the gluteal cleft. That's the medical term for the plumber's area of the gluteal region, for lack of better terminology. Those small pits are very common and typical in a pilonidal cyst. Sometimes people have just one of these or two. Sometimes somebody doesn't have the pits. That's more rare, but it happens as well. But it's fairly typical to see these small little holes that we call sinus pits or pilonidal pits that are oftentimes at the most bottom part of a pilonidal cyst, but can extend the whole region of the pilonidal cyst. I thought this would be a good photo because it shows a good set of those. We did the treatment. What we want to do with the treatment is eradicate all these little pits because they're points of entry for hair, debris, dirt, bacteria, whatever, to get back under the skin. And so we want all of that to seal up. And so we make small little holes, and remember that these are zoomed in. These actual holes are anywhere from 2 to 5 millimeters in size to get into those pits and then allow the body to heal them up. And so this next photo is 1 week out. We get through those pits, we make these small holes, we clean the wound out so there's no hair and debris in there, and then we obliterate the sinus cavity and the pilonidal kind of fibrous capsule that's underneath the skin. These little holes, or in medicine we say trephines, that we create will then drain fluid for a few weeks because burnt human flesh puts out fluid, and we want that fluid to come out. I do not want that fluid to trap underneath the skin. We want it to be able to come out and for the body to be able to heal naturally from inside out. This next photo is about 13 weeks out, so about 3 months after treatment, and you can see all the holes are closed. At the highest point, you could see the minimal scar. It's almost, you have to look for it at 3 months, and it becomes almost non-visible. And again, this is zoomed in. You're at the bottom, deep into the crack or the gluteal cleft. It takes a little bit longer because of the difficulty of that area. It could accumulate sweat and debris, and because of the folding of the skin, it's just a harder area, but it does close as well, and those will soften. I will later show another patient 1 year out, and you will see almost these little small scars are imperceptible.